Are you taking metformin for your diabetes? If you've started noticing your feet burning at night or a sudden wave of exhaustion after breakfast, your body is trying to tell you something. Metformin is often called the miracle drug for type 2 diabetes. It is the very first pill your doctor will prescribe when your blood sugar starts creeping up. Millions of older adults take it every single day, and for good reason. It works. But what many people do not realize is that while this medication is quietly lowering your blood sugar, it might also be quietly draining your body of essential vitamins. Over time, this slow, silent drain can cause a cascade of serious side effects that families and even some doctors completely miss. Most people think these changes are just diabetes getting worse, or simply the normal signs of aging. My name is Dr. Tom, and in my 14 years of working with older adults in my clinic, I've noticed a pattern that repeats itself almost every single week. When a patient sits across from me, holding a prescription bottle of metformin, I know we need to look closer. We have to look beyond just the blood sugar numbers on the lab report. We have to look at their energy, their nerves, their digestion, and their memory. Metformin is an incredibly effective tool for lowering blood sugar, but over years of use, it can quietly drain your body of essential vitamins, causing serious side effects that families and even some doctors miss entirely. In fact, research shows that long-term metformin use is strongly linked to vitamin B12 deficiency. And a lack of B12 is not just a minor issue. It affects your nerves, your brain, and your blood. But why does this happen? To understand the danger, we have to understand the mechanism. Metformin works brilliantly to stop your liver from pumping out too much sugar. When you sleep, your liver acts like a glucose factory, churning out sugar into your bloodstream. Metformin turns down the dial on that factory. But as a side effect, the medication sits in your gut, specifically in the lower part of your intestine, called the ileum. In the ileum, your body absorbs vitamin B12 from the food you eat. Metformin acts like a roadblock. It blocks the calcium-dependent gate that allows B12 to enter your bloodstream. Over the years, your B12 tank slowly drains. Because it happens gradually, the symptoms sneak up on you, masquerading as old age. Today, we are looking at 9 things every senior taking metformin needs to know, starting with the most overlooked sign of all. Number 1. New tingling, numbness, or burning in your feet and hands. If you have diabetes, you have probably been warned about diabetic neuropathy, the nerve damage caused by high blood sugar. But what if your blood sugar is perfectly controlled and your feet are still burning? This is where the B12 deficiency comes in. B12 is responsible for maintaining the myelin sheath, the protective coating that wraps around your nerve fibers like insulation around an electrical wire. When B12 drops, that insulation wears away. The nerves begin to short circuit. When George walked into my practice last month, he had been taking metformin for 8 long years. He complained that his socks felt like sandpaper. He said his feet burned every time he lay down to sleep. He assumed his diabetic neuropathy was simply getting worse, and he was terrified he might lose a toe. But we checked his blood sugar, and it had been perfectly controlled for years. The real culprit? A severe, metformin-induced B12 deficiency that had worn down the protective coating around his nerve. We started him on a high-dose B12 supplement, and within weeks, the burning began to subside. It wasn't the diabetes destroying his nerve, it was the silent side effect of his medication. This brings us to number 2 on our list: unexplained fatigue and shortness of breath. This isn't the normal tiredness of a long day in the garden. This is a profound, heavy exhaustion that makes your arms feel like lead. If you find yourself breathless climbing a single flight of stairs, or needing to sleep half the day away, you might assume your heart is failing or your age is catching up to you. But a lack of B12 causes a very specific problem in your blood. Your red blood cells are supposed to be small and flexible, so they can carry oxygen efficiently. Without B12, your body produces deformed, oversized red blood cells that cannot carry oxygen properly. This condition is called megaloblastic anemia. Your body simply cannot carry enough oxygen to your muscles, your brain, or your heart. You feel completely drained because your cells are suffocating. Number 3 affects your daily routine in a way that many people are too embarrassed to talk about: frequent diarrhea, nausea, or abdominal discomfort. Metformin is notorious for causing stomach upset when you first start taking it, but for some older adults, this problem never goes away. When Margaret came to my office, she admitted she had stopped going to her morning social club because she feared sudden diarrhea. She thought it was just a normal side effect of the pill, something she had to endure to control her diabetes. She was constantly bloated, nauseous, and rushing to the bathroom. But chronic stomach upset can lead to dangerous dehydration and weight loss in older adults. It strips your body of electrolytes and makes you afraid to eat healthy, fiber-rich foods. Number 4 is a danger you cannot feel, but it is absolutely critical to understand: a sudden worsening of your kidney numbers. Every medication you take has to be cleared from your body. Metformin is cleared exclusively through the kidney. As we age, our kidney function naturally declines. If you become dehydrated, or if you take certain blood pressure medications, your kidney filtration rate can drop suddenly. When Dorothy sat across from me holding her recent lab results, we saw her kidney filtration rate, her eGFR, had dropped significantly. She felt fine. She had no symptoms. But continuing her normal dose of metformin with failing kidneys could have caused the drug to build up to toxic levels in her bloodstream. When metformin builds up, it dramatically increases the risk of a rare but severe and potentially fatal condition called lactic acidosis. We immediately adjusted her dose to match her new kidney function, protecting her from a silent disaster. Number 5 often causes the most profound distress for families: new cognitive fuzziness, brain fog, or drastic mood changes. When Linda visited my clinic, her children came with her. They told me she just wasn't herself. She was forgetful, losing her keys, repeating questions, and acting easily irritated and sad. They whispered to me that they feared it was early-onset dementia or Alzheimer's. But remember what we said about B12? It doesn't just protect the nerves in your feet, it protects the neurons in your brain. A B12 deficiency directly impacts brain function and neurotransmitter production. Once we tested Linda's blood, her B12 was dangerously low. We supplemented her B12, and over the next few months, the brain fog lifted. Her memory improved. She got her personality back. It wasn't dementia, it was a medication side effect hiding in plain sight. Number 6 is crucial if you ever find yourself getting sick: muscle cramps, severe abdominal pain, and rapid breathing during an acute illness. We talked earlier about lactic acidosis. If you have a severe infection, pneumonia, a heart failure exacerbation, or extreme dehydration from a stomach bug, your body's oxygen levels drop. In these high-stress situations, continuing to take your metformin can be incredibly dangerous. The combination of illness, dehydration, and metformin can trigger lactic acid to build up rapidly in your blood. This is a medical emergency. You must always discuss holding your metformin with your doctor if you are hospitalized or suffering from a severe acute illness. Do not just keep swallowing the pill because it is part of your routine. Number 7, unintended weight loss and a poor appetite. While modest weight loss is often an expected and welcome effect when you first start metformin, losing too much weight rapidly is a red flag. When Robert walked into my clinic, his clothes were hanging off him. He had lost 15 pounds without trying. He said food just didn't taste good anymore, and he felt a constant, low-grade nausea. While losing weight might sound good for diabetes, excessive weight loss in older adults causes the loss of lean muscle mass. It makes you frail. It increases the risk of falls and bone fractures. If chronic nausea is stopping you from eating adequate protein and nutrients, the medication is doing more harm than good, and your doctor needs to know. Number 8, a failure to improve blood sugar despite perfect adherence. If you take your pills perfectly every single day, you change your diet, you go for your daily walks, and your A1C remains stubbornly high, you might feel defeated. You might blame yourself, but metformin alone is not a magic wand. Over time, type 2 diabetes progresses. Your pancreas naturally produces less insulin. If you have been on the maximum dose of metformin for years, and your numbers are creeping up, it means the disease has outpaced the pill. Waiting too long to adjust your therapy, or assuming you just need to try harder, only exposes your delicate blood vessels to prolonged high blood sugar. Metformin is often just the first step, and it is completely normal to need additional help as the years go by. And finally, number 9, the extended release solution. We talked about Margaret and her severe stomach issues. We talked about Robert and his nausea. If you are struggling with stomach pain, bloating, or diarrhea, you do not have to suffer in silence, and you should always consult your doctor before modifying your prescribed treatment. One of the simplest and most effective changes you can make is asking your doctor to switch you to the extended release version of metformin. The standard version dumps the medication into your gut all at once, causing massive irritation. The extended release version slowly dissolves over many hours, delivering a gentle, steady dose that is far easier on your digestive tract. It is a simple switch that has given thousands of patients their lives back. I want to be absolutely clear. Please remember, metformin is highly effective. It lowers blood sugar, it protects your heart, and it shields your blood vessels from the ravages of diabetes. You should never, ever stop taking it without your doctor's guidance. Our goal is not to create fear, but to create understanding. If you know what to look for, you can protect yourself. Instead of stopping the pill, take action. Ask your doctor for a simple B12 blood test at your next physical. Discuss your kidney function and ask what your eGFR number is. And if your stomach is in knots, ask about the extended release option. If this information sounds like exactly what someone you care about needs to hear, please take a moment to share this video with them. Send it to a family member or a friend at the senior center. It might help them finally understand what their body is going through. And please, share your own story, or tell us how many years you've noticed these symptoms in the comments below. We read every single one. Your story helps us build a supportive, informed community. You are not alone on this journey. We are here to help you navigate it, one step at a time. Let's dive a little deeper into how this all connects to your blood flow and cardiovascular system. When your blood sugar remains high for years, the excess glucose acts like microscopic shards of glass inside your blood vessels. It scrapes and damages the delicate inner lining, known as the endothelium. This damage triggers inflammation, causing cholesterol and plaque to stick to the vessel walls. Over time, these vessels become stiff and narrow. Your heart has to pump harder to push blood through these restricted pipes, raising your blood pressure. Metformin helps prevent this by keeping the glucose levels down, which is why it's considered cardioprotective. But here's the paradox. While it protects your large blood vessels from sugar damage, the resulting B12 deficiency can harm your microvascular system. The tiny, fragile capillaries that feed your toes, your fingers, and your eyes. Your nerves rely heavily on a constant supply of oxygen and nutrients delivered by those tiny capillaries. When megaloblastic anemia sets in due to a lack of B12, those deformed red blood cells struggle to navigate the microscopic pathways. The nerves in your extremities are the furthest away from your heart. They are the first to suffer when the oxygen supply is compromised. So you have a double hit. The myelin sheath insulation is wearing away because of the B12 deficiency, and the nerve itself is suffocating because of the deformed red blood cells. This is exactly why the burning, tingling, and numbness in your feet can become so unbearable so quickly. It's not just a surface-level symptom, it is a cry for help from your peripheral nervous system. This brings us to an incredibly important point about diet and nutrition. Many older adults believe they can simply eat more B12-rich foods to fix the problem. They start eating more beef, eggs, fortified cereals, and dairy, hoping their symptoms will disappear. But remember the roadblock mechanism we discussed earlier? Metformin physically blocks the absorption of B12 in the ileum. You can eat all the steak and eggs in the world, but if the B12 cannot pass through the intestinal wall and enter your bloodstream, your body remains starved of this vital nutrient. This is why dietary changes alone are rarely enough for someone suffering from a metformin-induced deficiency. In my clinical practice, when I see a patient with this specific roadblock, we have to bypass the gut entirely, or overwhelm it with a highly absorbable form. Often, we use sublingual B12 tablets. These dissolve under your tongue, allowing the vitamin to enter your bloodstream directly through the mucous membranes, completely bypassing the blocked ileum in your digestive tract. In more severe cases, like George's, we use B12 injection. A quick, simple shot delivers the vitamin straight into the muscle, guaranteeing 100% absorption. The results can be life-changing. Within weeks, patients often report a dramatic return of their energy, a lifting of the mental fog, and a significant reduction in nerve pain. But you cannot fix a deficiency if you don't know it exists. And this is where the medical system often fails older adults. The standard blood panels run during an annual physical count. The complete blood count, the metabolic panel, the lipid check, do not automatically include a vitamin B12 test. You have to explicitly ask for it. And the normal range for B12 in many laboratories is shockingly broad. A level of 250 picograms per milliliter might be flagged as normal on your lab report, but many leading neurologists and geriatric specialists consider anything under 400 to be dangerously suboptimal for brain and nerve health in seniors. This is why you must advocate for yourself. Ask to see the actual number, not just whether it was flagged as normal. Let's also return to the kidneys and hydration, because this is a daily risk you can actively manage. Your kidneys are the filters that clean the metformin out of your blood. Dehydration is the enemy of your kidneys. As we age, our natural thirst mechanism diminishes. Many older adults walk around in a state of chronic, mild dehydration. When you don't drink enough water, the blood volume drops. The the blood thickens, and the kidneys receive less blood flow. Their filtration rate slows down. If you are taking a fixed dose of metformin, and your kidneys suddenly slow down because you haven't been drinking water, the drug accumulates. It is vital to maintain adequate hydration, especially during the hot summer months, or when you have a minor illness. I want to leave you with a story of hope. Let's look at James, another patient of mine. James had been on metformin for a decade. He came to me exhausted, struggling with balance, and convinced he was declining rapidly. His previous doctor had told him to just accept his limitations, but James refused to give up. We ran the right tests. We found the low B12, the dropping kidney function, and the chronic dehydration. We switched him to the extended-release metformin, adjusted his dose for his kidney health, started sublingual B12, and got him drinking more water. 6 months later, James walked into my office standing tall. His balance was restored. His energy was back. He was back to playing with his grandchildren. He didn't need a magical fix. He just needed clarity, understanding, and a few simple adjustments. That is what true preventive medicine looks like. It is about understanding the delicate balance of your body, recognizing the early warning signs, and taking targeted, sensible action. You have the power to protect your health, your independence, and your vitality. Never settle for, "It's just your age." Keep asking questions, keep seeking clarity, and remember, your body is always trying to tell you something. You just have to know how to listen. Let's expand on how the liver interacts with this medication. The liver is the primary target organ for metformin. During the night, when you are asleep and fasting, your body still needs a steady supply of energy to keep your heart beating, your lungs breathing, and your brain dreaming. The liver provides this energy by converting stored glycogen into glucose, a process called gluconeogenesis. In a healthy person, insulin signals the liver to stop producing glucose once you wake up and eat breakfast. But in type 2 diabetes, the liver becomes deaf to insulin's signal. It keeps churning out sugar, which is why your morning fasting blood sugar numbers are often the highest of the day. Metformin steps in as a chemical messenger, telling the liver to shut down the factory. This is why it is so effective at lowering morning numbers. But this chemical intervention requires precision. It alters the fundamental metabolic pathways of the cell. Metformin also works in your muscle. Your muscles are the largest consumers of glucose in your body. When you walk, lift, or move, your muscles pull sugar out of the bloodstream to burn for fuel. In type 2 diabetes, your muscle cells become resistant to insulin, meaning the doors remain locked, and the sugar stays in the blood. Metformin acts like a mechanic, helping to repair the locks on the cell doors. It improves insulin sensitivity, allowing the sugar to finally enter the muscle tissue where it belongs. This is why pairing metformin with a simple daily walk is one of the most powerful things you can do for your health. The medication opens the door, and the walking pulls the sugar inside. But we must also consider how these metabolic shifts affect your sleep. If your blood sugar drops too low during the night, your body perceives it as a severe stressor. It releases adrenaline and cortisol, stress hormones, to force the liver to produce more sugar and save your life. This surge of adrenaline can jolt you awake at 3 a.m., leaving your heart racing and your mind spinning. You might think you have insomnia, but it is actually a metabolic response. While metformin rarely causes profound hypoglycemia on its own, when combined with other diabetes medications or poor meal timing, these nocturnal awakenings can become a chronic issue. This is why consistency in your medication timing and your evening meals is so vital for a restorative night of sleep. Consider Walter, who came to me deeply concerned about his heart. He had read online that diabetes medications could be dangerous. He was ready to throw his prescription away, but I explained to him that untreated diabetes is far more dangerous to the heart than any medication. High blood sugar literally crystallizes the proteins in your blood vessels. It accelerates atherosclerosis. By carefully managing his metformin dose, monitoring his kidneys, and ensuring his B12 levels remained optimal, we were able to protect his cardiovascular system while avoiding the hidden side effects. 5 years later, Walter's heart is strong and his mind is sharp. The key takeaway here is balance. Medicine is not black and white. It is not about taking a pill blindly, nor is it about rejecting medical science out of fear. It is about becoming an educated partner in your own healthcare. You must know the benefits, you must know the risks, and you must know the signs that something is out of balance. This is why we created this guide, and this is why we urge you to have open, honest conversations with your healthcare provider.